Welcome to Health Talks.
Is sitting the new smoking? Welcome to Health Talks. I am Shona Daly Germino, board certified nutritionist and the founder of Dietary Pathways. And today we are going to discuss, is sitting just as harmful as if you were smoking? Why sitting is not the new smoking. Sitting has been branded the new smoking for its supposed public health risks, especially for people with sit-down office jobs. Over the past 15 years or so, sitting has been linked with cancer, heart disease, and diabetes, and even depression. This has led to a surge in media stories on the risks of sitting. Even people who do a lot of exercise are still at risk. Different types of sitting were linked with developing type 2 diabetes. This includes sitting to watch TV or any other type of sedimentary type activities. Type and context of sitting. Let's talk about what that means. We are most likely to sit at work and play and while traveling. And a growing body of evidence suggests not all sitting is equal. For example, sitting down at work is not strongly linked with long-term health risks. Perhaps that's because higher status jobs involve more sitting, and higher position jobs is linked with a lower risk of chronic disease. It's a much different case for sitting such as TV watching, the type of sitting most constantly linked with long-term health risks such as type 2 diabetes, heart disease, and associated with early death. People who watch a lot of TV tend to not be as active and have poor mental health, eat unhealthy foods, and exposed to unhealthy food advertising. Each of these aspects of watching TV increases the chances of poor physical and mental health, but studies cannot account for all these complex influences. In other words, TV involves a constellation of health risks that go unaccounted. So TV studies only tell us that excessive TV viewing is a behavior that needs to be reduced, but tell us practically nothing about the health risks of actually sitting. Physical activity and sitting. 60 to 75 minutes of physical activity a day eliminated the harm of sitting when it came to measuring death from cardiovascular disease or death by all causes. One possible explanation for this is the weak links between sitting and diabetes that was observed in participants that participated in various research studies. They were also protected by high levels of physical activity. This suggests that people with desk jobs find hours in the day to add physical activity to their daily routine. As well as individuals changing their behavior, governments need to provide infrastructure for active commuting, like bike lanes and secure bike racks at stations, and encourage people to use public transportation. Employers could also provide incentives and facilities for active commuting, like providing showers at work, or even implementing gyms or a walking program, and also promote lunchtime walks. Encourage the use of stairs instead of elevators, and even walking to meetings when convenient. How about standing desks? This has been all the rage. We've probably all seen at some point, whether it be on TV or online, Veridesk. Do these desks really make a difference? Adjustable desks that allow a sitting and a standing option could be a good first step, especially for sedentary workers that tend to not get enough physical activity. But are these really a complete solution as people expend much energy or exert themselves using them? Even well-designed studies of people using sit-stand desks found replacing sitting with standing for 40 to 45 minutes each workday didn't provide any measurable health benefits. And people who use them may think that they've done their bit and tend to be less physically active after work. This is something that we really need to change. We need to recognize that there's nothing better than getting out and doing some walking, implementing cardio into our daily lives, not simply just standing. Reducing the amount of time spent sitting can be useful for people that don't want to walk, cannot walk, cycle, or exercise, such as people with disabilities, such as arthritis. But if you have to cut back on your sitting by many hours a day to achieve a reduced risk in these diseases, even doing 1 or 2 exercise sessions a week would be beneficial. Although we tend to assume it's easier to reduce sitting time than to promote physical activity, exercise, and unfortunately, these are equally hard to tackle. Rather than being the new smoking, we need to think about this a little bit differently. We need to think about sitting as an important part of the wider problem of physical inactivity. We also need to read between the headlines of how media covers sitting. Research published in news and medical journals shows that 30 to 45% of media stories on sedentary behavior promoting misleading messages such as sitting undoes the benefits of exercise. So the first priority is to get exercise in some way. Implement cardio, whether it's just walking 20 minutes a day after dinner. And absolutely cut out any risk by not smoking. The best two things that I can advise in this whole presentation, and the thing that I really want to drive home and express, is that get out, be active, find an activity outside of work that gets you going, that makes you feel good, and get the exercise you need. Start off light and build up. And also, smoking is never okay. Lately, we've seen a slew of things in the media suggesting that these standing desks are somehow a substitute for physical activity. This is a falsity, and we need to be clear that there is no substitution for exercise. Simply standing won't give you the same benefits as if you were to implement cardio such as walking, bicycling, even lifting a few weights, stretching, yoga. There are many different ways that you can implement activity and exercise into your lifestyle. Standing desks won't substitute that. And we need to make sure that people reading these articles understand that standing desks will not protect you from any disease, and they don't have practically any bearing on your health, one way or the other. Now, one thing to note is if you have back problems, standing might be a little bit more beneficial. But again, this doesn't do anything to protect you from any diseases. It simply just may be better on your back. So be conscious about what you read and the false articles out there. There's nothing better than getting out and getting exercise. This has been Shona Daly Trimino, and I hope you've enjoyed this presentation by Health Talks.